The World Health Organization just declared global trade and travel to be more important than human life. Good afternoon, everyone. I'm Chris Martinson, and this is your coronavirus update for Thursday, January 30th, 2020. Well, there's the headline. Novel coronavirus outbreak, a global health emergency. So they declared it a public health emergency of international concern, but we're not really sure what that means to them because, however, the UN health body stressed that it does not recommend limiting trade in travel. Now, as we covered yesterday, this virus has a long incubation period. It's highly infective. It's got a very serious complication rate, and it's got a fairly elevated death rate, but we don't actually know what that is. We'll get into that in just a second. Given all of that, the World Health Organization is like, pretty serious stuff, but we wouldn't recommend limiting trade and travel. I mean, let's just look at this. This is an extreme emergency at this point in time, I think, based on what I'm seeing in the data right now. And we'll get to some of that. And also, I'm a little bit just unnerved, I guess I have to confess, because I can't get any information out of China. There's been a complete lockdown on any information coming from people out of there. All I know is that there's some bare streets and nothing's moving around. But I don't have a good sense of just how bad this emergency is quite yet. So the global health trade, not health trade, it's not the World Trade Organization, World Health Organization. Easy mistake to make, though, because they've said, we want travel and we wouldn't want to set global trade on fire. That's more important. Now, here's why this really matters to me a lot at this point in time. Oh, no, by the way, not for nothing, but the World Health Organization spent quite a bit of time being very, very, very polite to China. And I think it's worth noting that Taiwan, they got some international support, but they've been barred from the World Health Assembly. And of course, Taiwan and China have a long-standing sort of feud, if you can call it that. And China wants to control Taiwan, and Taiwan says no to that. And Taiwan will find itself sidelined during the upcoming annual Health Summit of the World Health Organization to be held in Geneva in late May for the third straight year due to objections from China. So if you had any questions or concerns about, is the World Health Organization about health? Or is it maybe a little bit politicized? Well, obviously, this says it's politicized. But I'm wondering, too, what their motivations are here. I'm not convinced that it includes watching out for your health or my health in this particular story. Let's go to the numbers real quick. As of right now, this is the count that we've got, 8,246 for cases. This is a really low number, of course, and deaths at 170. I trust the deaths may be tiny bit more than the cases, but not a lot more, and I'll show you why in a second. But the cases themselves, we have to trust that enough test kits were in place and that those test kits got run and that the cases have been caught. Now, listen, some people are going to catch this virus and just get some light sniffles and they'll be done with it. Other people are going to have more serious complications. But the people who are actually infected with this, if you haven't tested them all, even the people who have the light symptoms, you're not going to catch them, obviously. So I think this case number is exceedingly low at this point in time. All we may be tracking with the coronavirus case number is how fast China can ramp up its testing apparatus. All right. And this came out. This was something that, again, I don't have a lot of confirmation, except I saw many news stories about it. Probably you did too. China accused of cremating bodies in secret as coronavirus patient numbers spike. And a lot of anecdotal evidence and data from people saying that the crematoriums in China in Wuhan in particular, were running 24/7, and that they would be managing hundreds and hundreds of bodies per day if they were running 24/7, rather than the total 170 cases across all of China that we've seen right now. As we move on down, this is a blog. It's wonderful. I've got the URL for you here. And this came out on January 27th, so it's a few days back, 3 days back now, from a John McGorry. And there you can see he took a great picture of that's what Wuhan looks like. That's the amount of commerce that's happening in, 11 or 12 major metropolitan areas, including Shanghai, Suzhou, Beijing, the big ones, right? And here's what he wrote. He said, I don't know where he's getting his information from, but this is a person who is actually in there on the ground taking pictures and writing blogs. So he wrote, Wuhan doctors estimate 250,000 carriers of the deadly coronavirus exist in the city. Is that the right number? I don't know, but it certainly seems that the number we have been given is actually quite low. And this shows you how serious it's all being taken. A few thousand cases and 100 deaths, really, honestly, that wouldn't set anybody back in terms of their thinking in probably any country that you might think about, certainly not China. But here, this is the school where he's taught for the past 6 years. Wuhan University canceled spring semester, so the whole semester's out. 2 new hospitals. The city began building 2 new hospitals now to care for the afflicted, and this sounds like the city knows what's coming. So if we look now a little bit more news, I'll go through it very quickly. We now have the Wuhan coronavirus now, all 31 regions of China, so contained by the quarantine? Nope, not at all. France confirmed the 6th case of the coronavirus today. And person-to-person transmission reported in the United States. That was a couple where one gave it to the others, but this is now a person-to-person transmission case in the United States. And here we now have a report of a coronavirus death outside of China. And this is in a 22-year-old youth who died in a Malaysian hospital, reportedly infected by the dreaded virus. So we're going to wait a little bit and see what kind of confirmation we can get for that. This is the kind of stuff that's driving me nuts in the United States. Maybe you have it in your country too. Ex-Obama health advisor, U.S. needs to stop panicking and being hysterical about coronavirus. First, I don't know what this person is talking about. I don't see anybody in the United States so far walking around with respirators even, let alone doing anything that would remotely be called panicking. So I'm not sure where this comes from, and I'm not sure how this person ever was qualified to be a health advisor to the White House. Because he says here, everyone in America should take a very big breath, slow down, and stop panicking and being hysterical. I think we need to put it into context. The death rate is much lower than for SARS. That's the comparison being drawn. Remember that nice comparison I showed you CNN was giving you? So the health advisor, Ezekiel Emanuel, says the death rate is much lower than for SARS. So let's check that. Let's bring out the old data paddle, see what we can find. Oh, look here, a beautiful chart put out by this user, the JJ Bug, over here on Reddit. Found this just earlier today. Thank you, JJ Bug, for updating these. These are just wonderful charts. Very, very helpful. And so here we're looking at swine flu deaths in red, coronavirus deaths in yellow, SARS in green. And these are not perfectly, purely beautiful exponential curves like you would expect in a pandemic, but boy, this one is. And speaking of the rate of death, I think what we're looking at here is first, the absolute number of deaths on a time series is higher than for SARS and for swine flu. And if it keeps up at this rate, it's just going to totally blow these away and eclipse them. So how does the health advisor not have access to information like this or care enough to find it before they go out publicly and start talking? Part of the reason we're not getting any information out of China is that you can go to jail for 7 years if you post any. So they've really put a clamp down on all kinds of reporting. And so that's really why we're not getting up the curve of any more information. I haven't seen a single video file from inside a hospital in probably 6 days now. So this is the reason. And CNN, hey, piling on, had this nice piece here, came out at 11:06 today, said, a deadly virus is spreading from state to state and has infected 15 million Americans so far. It's influenza. I don't know if they're trying to, I don't know what CNN is up to here. But again, by the numbers, CNN, no. nCoV is far worse than the flu. I went over this data yesterday. The case fatality rate, the R0, the serious complication rate, they're not even remotely comparable to each other. And oh, by the way, you might want to know this, Scotty Andrew of CNN, that influenza, when it comes over here, there's an enormous cohort of the population that has immunity, which really helps stop the spread. Nobody has been exposed to this coronavirus, so it's a completely virgin territory for this virus to come and spread across. Continuing on, here's Bloomberg. Coronavirus misinformation is spreading all over social media. This is the thing that they decided was most important. One set of tweets and Facebook posts from U.S. conspiracy theory accounts said drinking bleach could protect against the virus or even cure it. On YouTube, a series of videos accusing media organizations of suppressing information had hundreds of thousands of views. Well, that's this channel. That's what they're referring to. If you clicked on this link and followed it over, you end up on this channel in the videos I've been producing. And yes, Bloomberg, you got it wrong though. And this is why we don't like you guys in the media doing this stuff. I didn't accuse the media organizations of suppressing information. I accused the media organizations of misinforming or underinforming people about something that's very serious. And I stand by that assertion, and I'm going to continue with that. So this is going to be something that I'm going to continue to battle and challenge a little bit, but it's not one of these media organizations has reached out to me to say, can we talk about the data you've got? We have different data. We'd like you to talk with our science people, and we can come to the bottom of why we think you have your numbers wrong. Nah, they're just going to smear these assertions up here, and they've put an accusation against me next to somebody who said drinking bleach would protect against the virus. For the record, my PhD in pathology is from Duke University, and I got a fine medical training there, and I learned a lot about these things. So if any media organization wants to talk science with me, we can do that. And I'd be very happy to do that. That would be wonderful. But the ad hominem attacks really don't float with me. Moving on. I wanted to go a little deeper into why knowing the R naught is so critical. So I just put together a couple of tables here so we can just sort of compare things. Remember, an R naught is asking this question. If during the entire time that I have and I'm infective with a current virus, a certain virus, what is the chance that I'm going to spread it and to how many people? Right? So if I have an R naught of 1, in this case we're looking at an R naught of 1 here, if during my infective cycle I might pass it to one other person, so now 2 people have had it, me and the other person, and then they have an R naught of 1 as well, and so, or the virus does, and then they pass it to one person, so there's 3 people have had it total, cumulatively. Me, the next person, the next person. So with an R naught of 1, this thing can persist through, and after 10 hops, after we've gone through 10 of these infective cycles, you have 11 people. That's what an R naught of 1 does. It neither really, it doesn't grow through the population, but it persists. So that's with an R naught of 1, and what's important to note is the flu. The flu that CNN was just so proudly proclaiming as the same, or even more deadly, or something you should worry about more than the coronavirus, that has an R naught of 1.28, which means, and I don't have decimal points in here, so these are all rounded numbers, but look what happens even when we bump from 1 to 1.28. By the end of 10 hops, now there's 15 people, so this is growing, it's persisting and actually growing a little bit, spreading through the population. That's what 1 to 1.28 does it. Now, this is why it's really critical. What do you think happens when we get Spanish flu as an R naught of 1.8? I'm going to bump this next table to 2. Here's what happens when we go to an R naught of 2. All of a sudden, because you go here in the first cycle, it gets spread to 4, it gets spread to 8, it gets spread to 16, it gets spread to 32, and by the end of this, by 10 hops, now 2,048 people have been or are currently infected, compared to 15 and 11. That's what the R naught is doing for you. Now let's ask the question, though, what happens if we ran that out to, say, 20 hops? Where does that take us? All right, sorry, this got clipped off a little bit on the side, but 20 hops means that we had R naught of 1, you got to 20, and R naught of 1.28, you get to 178, and an R naught of 2, and you get to 2,097,152. So what happens now when we take that to an R naught of 2.5, which is where we think this coronavirus is? Well, interesting numbers. By the 10th hop, we are now at 23,000 people compared to 2,000 compared to 15. So this 15 to this 23,842, that's what CNN wants you to believe is a comparable statistic. They're comparing a virus where we have herd immunity and which has an R naught of 1.28 against a brand new virus with no herd immunity with at least a minimum R naught of 2.5. They're comparing 15 to 23,842. And if we jump that out to 20 hops, what happens? Well, now, after the 20th hop, we have 227 million and change people that have been infected compared to that 178. So that's just ridiculous. Just ridiculous for CNN to compare that. Now, I want to take you through a little bit of science. If you like science, stick around for this part. If you're not into the science, you can tune out here. But the science is about how this virus actually works and why it's hitting men harder than women right now. Thank you for watching. For those of you who are interested in finding out the science behind why the coronavirus may be a bigger threat to men, click here.